In 2017, I read the comprehensive plan. And I don't know whether you've read the Kent County Comprehensive Plan, but it had in there several sentences that I thought were stunning. First one was, Kent County was founded in 40 something or other, and it depended on fishing and farming. And the next sentence was, things have changed since 1640, but not so much. And the last sentence was, to keep Kent County the way it is, there are trade-offs. And one of them is that there will not be jobs for our young people here. I thought, what? So that's when I started thinking about running for something, because clearly something needed to be done. And I had been for 8 years, have been for 8 years on and off, a member representing Kent County on the Maryland Workforce Investment Board. And this is the organization that provides federal and state assistance to people either without jobs or people who have lost jobs. In other words, we try to train them, prepare them to get back into the workforce. From that vantage point, I saw, I guess I could describe it as the people who don't have everything. And I became very conscious of the poverty level. There's a high poverty level in Kent County, I mean, almost 16% now. But across the 9 counties of the Eastern Shore, it's not very good at all. But Kent County has a reputation for being a rich county, simply because there are rich people who live here. But that perception, which is totally wrong, affects all sorts of things. It affects how much money the state gives to schools. We are considered one of the 3 wealthiest counties in Maryland for education assistance purposes, and it's just simply crazy. So I decided in November, I guess it was, of last year, that I would indeed run for it. And then I began looking into things that I'd never looked into before. I found out that the county's revenues are flat. They haven't gone anywhere up in about 10 years. I found out that that's a very good reason why lots of things haven't happened, like full funding for the public school system. I found out that there are 7,000 senior citizens living in Kent County, and a large percentage of them don't have the money or the good health to take care of themselves. There are a lot of things I found out. And because I'd been doing for 15 years work in these crazy war zones or third world countries, improving the quality of life, basic quality of life for people overseas, I thought, gosh, maybe I can contribute something along those lines to Kent County. And that's what my platform is. Basically, it's more health services. And I want to, for instance, apply again for federal health care. It's not an insurance policy, it's a system, health system. You have it in your county. It's called the Chop Tank Health Services. And I'd like to apply for that. It was developed for underserved counties and cities in the United States a long time ago. We applied 10 years ago. Kent County did, applied 10 years ago to become a federal, to join this federal system that provides health care for underserved people or communities, and we were adjudged to be officially adjudged to be an underserved population. There are, there are now 2 of these federally funded facilities. One is in Talbot, and the other one is in Caroline. We applied and were turned down. We were turned down because there was then, you remember, there was a hospital here. And we had enough physicians and specialists here that the feds decided that we didn't really need the extra assistance. Well, in the last 10 years, things have gone downhill, which is why I want to reapply. I also discovered that the Veterans Administration has a large number of local clinics, which obviously are intended for veterans and their families. We've never applied for one of those, although we have large numbers of veterans, myself included, I will say. So I thought, okay. And then I have met with some of the SOS folks, and I'm meeting with them again on Thursday. But, you know, they're wonderful young mothers, basically, and fathers who want the best for their children, and that's fine. I mean, that is admirable, and they brought the problem publicly, and I think rather powerfully, to everybody's attention. But they are not focusing on the basic problem, which is the county cannot afford to give them everything, all the funding that they want. They simply can't. Our county revenues go from 46 million to 51 million. Now they're under 50 million. And the chances are it's not going to go up. So I look at Kent County as I used to look at foreign countries. That is, as a need of a package of services at a level that they're not receiving now. And I've broken that down into, you know, a number of categories. But basically, it's healthcare, it's housing, it's education, public education, and it's public transportation, and it's also recreation for everybody. I mean, so if elected, that's the approach I would take. I've invented something called Plan Kent 2025, which is in 7 years. I'd like to have made progress to provide additional services to all the people in Kent County of whatever age, from children on up. And that's going to require some doing. Yeah. The conditions don't exist now that will attract young families. They just simply don't. Which is why most young people leave if they're born here, and very few come here. You can't even birth babies in Kent County. And there's a relatively simple solution. You establish what's called a birthing center. There's a big one in Annapolis, which a number of people who can't afford hospitals use. And so that's an approach I'd like to pursue. Basically, the county needs to increase its revenues substantially. And in terms of the schools, the county hasn't made a very, shall we say, proactive effort to respond to the state's essential formula, which denies counties like Kent County the additional finance assistance it needs for the schools. They probably told you, I mean, there's something called wealth per student, which is an important element of the formula. And wealth per student is the dumbest statistic that anyone could invent, because it divides the rather substantial real estate taxes that the county takes in by the declining number of students. So we have the third largest wealth per student figure in the state, which is outrageous. I mean, it makes no sense. That has to be, I think, very strenuously, powerfully, with allies on the Western Shore, attacked, because what it's doing is punishing truly poor counties, poor communities, with something that's suitable for Montgomery County, maybe, or Prince George's, but definitely not the Eastern Shore. So that's the flaw.
Yeah. I think that, let me back up, but like maybe 4 years ago, 5 years ago, I did an editorial that Kent County and Chestertown pay the price for being small. It is expensive to be small in our world. And I wonder at times whether we continue to be very narrow in our perspective of solutions. I mean, could you see a day where we would just simply combine the Queen Anne school system with Kent County? Is there, I mean, why have that redundancy? Why have that kind of overhead for a small system?
Unless there's, in my view, unless there's a substantial change in the attitude of the county commission, and also not just the county commission, but the people who elected them, to understanding that they want Kent County, these people, essentially to be a national park. They're opposed to development. They don't think in strategic planning terms into the future. If you're planning for a worse future, then you can stick with what you've got. If you want the county to actually come alive and progress in 7 years to the point where it has a viable business establishment that is providing additional revenue and jobs for the people and the county, then there has to be this kind of development. But the people now who are in office, I mean, I know them all. I've known them for 20 plus years. But that doesn't mean I agree with the approaches they've taken. And I think the likely outcome is that there will be a group of 3 commissioners, some of whom belong to what I call the old school of Kent County governance. And I hope I'm the 3rd one who has a more sort of future-oriented outlook. Well, you know, people like the mothers in SOS and Margie Ellsberg and all these other citizens, largely Chestertown, who rise up in high dudgeon to defend the county, but it's defend the county based on their perceptions of the county's need. I think Margie is absolutely, totally wrong. Modern medicine, that is, 21st century modern medicine, is focused on in-home care. It is not focused on going with a bad flu case and staying in the hospital for 6 days. Those days are gone. My focus is on services. What we have here is what the model is that the legislature in Annapolis has accepted. It is a large emergency ward and continuing modern diagnostic analysis. They can do any blood test, any scan reading that they need. What it's not is what they call a 3rd category critical care hospital, and there will never be one here. We don't have the population, there isn't the money, and hospitalization these days is a business. That's my approach.
Yeah.
So what I want to do is to sort of try and communicate an understanding of what healthcare is today across the country, but particularly in rural health situations.